All right, let's bring in Chief Innovation Officer at Boston Children's Hospital and ABC News medical contributor, Dr. John Brownstein. John, good to see you again. You know, you heard Biden. We talked earlier this morning. We watched what the president had to say. He says no shutdowns, no lockdowns. Do you agree with this stance by the White House? It seems a little bold, taking into account we don't know a lot about this variant right now.
No, it's true. We don't know a lot. But even if Omicron does do a better job of evading the vaccine and the immunity we get from it, which is potentially likely, this doesn't bring us back to March 2020. We have so much more now than we did back then. Obviously, there's a lot of natural immunity out there. Many have been vaccinated. And really, the reality is that, we have testing, we have therapies. So our vaccines may take a hit, but we get a lot of protection anyways. And so we won't see these sort of shutdowns or lockdowns, but there is urgency to figuring out widespread vaccinations, boosters, testing. We may see mask mandates, limits to indoor gathering, but really I doubt any lockdowns are going to come in our future.
And Doctor, health authorities in the United States telling everyone to get their booster shots as soon as possible. Some Americans already have. A lot of people might be a little bit confused, though. This is a new variant. Would the booster shot work? Is this still a good idea? So, especially given the fact that this variant has not reached our country yet, how do you answer that confusion about new variant, booster shots? What should we do?
We did an analysis on my team here at Boston Children's. We found that 4 out of 5 eligible adults have still not received that booster. And honestly, if Omicron doesn't give you that incentive, I'm not sure what will. What we recognize is that booster will dramatically reduce your risk of infection from Delta, which is what is surging right now, but also very likely protects you from Omicron. And so even in the worst case scenario, if our vaccines do take a bit of a hit, they will not be useless. And this is why that additional protection you get from a booster is so important. It gives you the additional edge. And I know there's some that might be waiting for a new formulation from the vaccine manufacturers. That is still months away. So now is the time to get that booster and really not delay for any potential new vaccine down the road.
We just got back from Thanksgiving. We were gathering, we were traveling. Everybody was going a number of different places, and we felt good about it for the most part. Now, you've got the holidays, once again, just weeks away. Hanukkah's already started. So what are you thinking we should do? We don't know a lot, but at the same time, we also know that symptoms are mild. So do we just practice the proper protocol and continue with our travel plans?
Right. So I wouldn't change anything right now. It's all about increased vigilance. And of course, we have to be flexible. Things may change. And we're already seeing, restrictions in terms of travel across the globe. So if your holiday travel plans do include going somewhere outside of the U.S., you're going to have to really stay in touch with what's happening in terms of both whether there's restrictions or additional testing or quarantine. But also what we can do now is, of course, the vaccines. I mentioned boosters, but also pediatric vaccines. We only know that 13% of eligible kids have been vaccinated, those under 12. We can really ramp that up because we know protecting our kids also protects the community. But of course, as you think about traveling this holiday, it's all the same things, right? Masking, social distancing, all the things that we do right now, plus testing, that will keep us safe. But ultimately, I think we will be able to travel this holiday season.
And Doctor, we live in this era of really remarkable scientific capacities and hyperspeed media capacities. And the combination of watching this virus mutate, variate in real time around the world, instantly we know something's over there, something's happening. I'd like you to talk a little bit about the reaction, not just in the media, but among all of us as we learn how to watch a new virus in the world, evolve in front of our eyes. Are we panicking too much? Are we paying it the right amount of attention? How do you look at that issue?
As an epidemiologist, of course, I love seeing real-time data and science play out. The fact that we can get this kind of data, identify a variant, start tracking it around the globe, see these cases, and identify them so quickly. That's incredible. So from a scientific perspective, it was important for us to get a jump on this variant. But the double-edged sword here is that the problem is that this also can create panic. People are fatigued by COVID, and seeing another variant emerge, that is a real concern. And so I do have this concern that it has been somewhat overblown in the media. We have so many questions to answer. Is this more transmissible? Is this more severe? How well do the vaccines work? We just don't know. So there's more questions than answers. So yes, incredible scientific progress with this variant, but I really want to urge caution. We just don't know enough. And so for now, we just keep doing what we've been doing all along.
And, we haven't talked about this for a while, the timeline for kids under 5. There's still a lot of parents that want to get their kids vaccinated that are under 5 years old. What do you think? Are we going to finally have approval for that?
I think it's coming. And unfortunately, for many parents, it's not happening soon enough. But, we need enough data. There is no shortcuts when it comes to vaccinating our kids, especially those under 5. That data will come January, February. I likely see authorization in February, March, maybe April. I know that, so many parents are anxious. It's coming. There just needs to be enough data to make sure that it's safe in our kids. I think likely it will be, but we just have to wait a little bit longer.
All right, Dr. John Brownstein, as always, thanks very much for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.